She filled the pot from her own kitchen tap. Pasta water. A Tuesday night in November, she had made this exact meal 100 times. 8 days later, Carol Watkins was on a ventilator in the ICU at Banner University Medical Center in Phoenix, Arizona. Her brain was swelling. Her husband stood in the hallway with a paper cup of cold coffee and could not remember how to breathe. The doctor had just told him something that did not make sense. His wife, who had not left the state in 11 years, who had not swum in a lake since she was a teenager, who had done nothing more exotic than boil water for pasta, had a brain-eating amoeba. The amoeba was not in a lake. It was not in a river, not in a pond, not in any body of water anyone would think to avoid. It came out of her tap, in her kitchen, in her own home. This is system failure. She was 53 years old, a dental hygienist, married to Doug for 27 years, 2 adult children, both out of state. She had a raised bed garden in her backyard where she grew tomatoes that she said were too good to share, and then shared them with everyone. She was the kind of person who remembered the names of her patients' children, who brought soup to neighbors she barely knew, who still called her mother every Sunday evening, without fail. For 30 years, she had never been seriously ill. She had never been hospitalized. She took a multivitamin and blood pressure medication and considered herself, in her own words, aggressively boring when it came to her health. It was the second week of November 2021. Phoenix had recorded 11 consecutive days above 85 degrees Fahrenheit, which was unusual for autumn but not unheard of. The city's water infrastructure, pipes, storage tanks, the residential hot water heaters fed by them, had been sitting in prolonged heat. On the evening of November 9th, Carol made spaghetti bolognese. She filled a large pot from the hot water tap because it boiled faster. She had read this somewhere years ago and never questioned it. She had done it 100 times before. This time, something came out with the water. Something that had been living in the pipes, waiting for exactly this temperature, exactly this moment. Carol could not see it, could not smell it, could not taste it. She drained the pasta, served dinner, watched half an episode of a show she liked, and went to bed. She felt completely fine. She was not fine. She just did not know it yet. Here is what Naegleria fowleri is: a single-celled organism, an amoeba, one of the oldest predators on Earth, older than fish, older than insects, older than anything that walks or swims or breathes air. It evolved when the planet's surface was still being decided, and it has one very specific hunger: brain tissue. Here is how it enters the body. Not through the mouth, not through the stomach. Swallowing it does nothing. Stomach acid kills it. The only way in is through the nose. When warm water enters the nasal cavity, Naegleria can travel directly up the olfactory nerve, the nerve that carries the sense of smell straight into the brain. It does not have to break through anything. The nerve is already connected. It is a direct highway from the outside world into your skull. Most of the time, the amoeba is dormant. It exists as a cyst in soil, in sediment, in water, in pipes. At low temperatures, it does nothing. It waits. But Naegleria fowleri activates at warm temperatures, specifically above 77 degrees Fahrenheit, which is not very warm, which is pool temperature, which is garden hose temperature on a summer afternoon, which is, in Phoenix in November, after 11 days above 85, the temperature of water sitting inside a residential hot water heater. When Carol used the hot water tap to fill that pot, the water was 89 degrees. She stirred the pasta. She breathed in the steam. The steam carried water droplets into her nasal cavity. In at least one of those droplets, a single amoeba had already activated. It attached to the mucosal lining inside her nose. It found the olfactory nerve. It began to move. The olfactory nerve is surrounded by a sheath of tissue that connects directly to the olfactory bulb at the base of the brain. There is no blood-brain barrier on this pathway. It is the one place where the outside world has a direct structural connection to the brain. Evolution never armored it because nothing was supposed to come through it. Naegleria fowleri does not know that. Once inside the brain, it does something that has no equivalent in medicine. It eats. Not metaphorically, not by releasing toxins that damage cells. Literally, it extends pseudopods, finger-like projections, wraps them around neurons, and consumes them. Then it divides. The two new amoeba each begin eating. Then they divide. The condition it causes is called primary amoebic meningoencephalitis, PAM. It destroys the brain from the inside while the immune system responds with catastrophic inflammation. The brain, sealed inside the skull, has nowhere to swell. Pressure builds, tissue dies. The amoeba keeps eating. From first exposure to death, in untreated cases, is typically 3 to 7 days. Carol had 8. She was already one of the rare ones. Day 1 after dinner, nothing. Carol went to work, cleaned her teeth, asked about the kids, and drove home. Day 3, a headache settled behind her eyes. Not severe, the kind of headache you dismiss. She took 2 ibuprofen and went back to her gardening. Day 4, the headache was worse. Nausea joined it. Carol told Doug she was coming down with something. He suggested she call in sick. She did not. Day 5, light bothered her. The kitchen felt too bright. She closed the blinds and sat in the dark for an hour, which was completely unlike her. Doug made dinner that night. Pay attention to what was missed. Headache, nausea, sensitivity to light. 3 days after steam exposure from a tap in the one city in America that had logged the hottest municipal water temperatures that autumn. These were not flu symptoms. These were the first 3 signs of a brain under attack. By day 5, the amoeba had already consumed her olfactory bulb, the part of her brain that processed smell. She had not noticed because the loss was gradual, because you do not notice things disappearing slowly. Day 6. Doug found her sitting at the kitchen table at 4 in the morning. She was staring at the wall. Her eyes were open. When he said her name, she turned slowly. She said, "The smell. Everything smells wrong." He asked what she meant. She could not explain it. She went back to bed. Day 7. Fever, 103. Her neck began to stiffen. Doug drove her to the ER. The emergency room at Banner University was busy. A Monday evening in Phoenix, the waiting area was full. Carol was triaged, given a bed, and seen within an hour. The ER physician was thorough. He examined her neurologically. He ran blood work. He ordered a CT scan. The scan showed early cerebral swelling. He was concerned enough to admit her immediately. He asked Doug the standard questions. Any recent travel? No. Immunocompromised? No. Any new medications? No. Any animal exposure? No. Any known infections in the household? No. Nobody asked about water. The working diagnosis was bacterial meningitis, fever, headache, neck stiffness, photophobia. The classic presentation. The most dangerous treatable infection in neurology. He started intravenous antibiotics within 40 minutes of admission. Ceftriaxone, vancomycin, dexamethasone for the swelling. It was the right call for the wrong disease. The antibiotics fought an enemy that was not there. Meanwhile, the real enemy kept eating. Day 8. Carol was not improving. Her fever climbed. Her level of consciousness dropped. The antibiotics were doing nothing because bacterial meningitis was not what she had. The neurology team was called. An infectious disease consultant reviewed the chart. Something did not fit. The spinal fluid analysis, the spinal fluid drawn in the ER, showed a white cell count pattern that was unusual for bacteria. Not impossible, just unusual. One note in the chart flagged it. The note was not acted on. By afternoon, Carol was transferred to the ICU. She was becoming difficult to rouse. The swelling on repeat CT had worsened. Doug called their daughter in Seattle. Their son was already driving from Tucson. That evening, a second-year infectious disease fellow, Dr. Marcus Webb, reviewed every chart on the ICU floor as part of his overnight rotation. He stopped at Carol's. Bacterial meningitis was not responding to 72 hours of appropriate antibiotics. an unusual spinal fluid pattern, worsening despite treatment. He went back to the admission notes. He read every line. There was one question nobody had asked. He found Doug in the family waiting room at 11:15 at night. "Mr. Watkins, I need to ask you something that might sound strange." Doug looked up. "Has Carol had any contact with water recently? Not swimming, not a lake. Any water at all? A hot tub, a neti pot, a humidifier, a steam shower, tap water inhaled or introduced to the nose in any way?" Doug stared at him. "She boils pasta with the hot tap," he said. "She always does that. She said it was faster." Dr. Webb nodded slowly. He walked back to the nursing station and picked up the phone. The wet mount on Carol's spinal fluid was ordered at 11:47 p.m. A wet mount is not a standard test. It is not on the routine meningitis panel. It is a direct microscopic examination of fresh spinal fluid, looking not for markers or antibodies, but for the organism itself, something alive. The laboratory technician who performed it had been working at Banner for 19 years. She had read about Naegleria fowleri in a continuing education module 4 months earlier, a case study from Florida. It had stuck with her, the way rare things stick with people who have been doing a job long enough to know that rare is not the same as impossible. She focused the microscope. Something was moving, not drifting, not settling, moving with direction, extending projections, retracting, extending again. Purposeful. Her hands were steady when she reached for the phone. Her voice was not. "Dr. Webb, you need to come to the lab right now." The CDC was called at 12:19 a.m. The drug, Miltefosine, the only medication with documented efficacy against PAM, arrived from Atlanta at 4:41 a.m., transported by a courier whose entire job that night was to get one package from one city to another as fast as legally possible. By 5 a.m., it was in Carol's IV line. It was day 8. The 5 known survivors of PAM in the United States since 1962 had all received treatment by day 5. Carol was 3 days past that window. The doctors induced hypothermia. Cooling the body to 93 degrees Fahrenheit slows the amoeba's metabolism. Combined with miltefosine, amphotericin B, and fluconazole, it was the most aggressive protocol the hospital had ever deployed for a single patient. For 4 days, nobody slept. Not the doctors, not Doug, not their daughter, who had arrived from Seattle with a bag she had packed in 6 minutes. While Carol was in the ICU, Doug sat in the family waiting room and did something that a lot of people in his situation do. He searched the internet. He found almost nothing about Naegleria fowleri in tap water. Everything he found was about lakes, warm, fresh water, swimming. The horror stories were all about children at water parks, teenagers jumping off docks, people who had made obvious choices in obvious places. Not a 53-year-old woman boiling pasta in her kitchen. He told Dr. Webb this later. "I didn't know it could come from a tap. Nobody knows that. Why doesn't anyone know that?" Dr. Webb did not have a good answer. That question is exactly why this channel exists. Every case we cover here is a case where the information existed somewhere in a textbook, in a CDC report, in a medical journal, and the person who needed it most never got it. If you found this video because you were worried about something, or because someone you love is sick and the diagnosis isn't adding up, stay here. Subscribe, because next week we will cover a case that may be even closer to home than this one. And if you tell one person about this channel, that is one more person who knows to ask the question Carol's doctors almost never asked. That matters. It genuinely does. Day 12. Carol's fever broke. Day 16. Her eyes tracked when her daughter spoke. Day 21. She said Doug's name. He had to leave the room. She was discharged after 38 days. She had been on a ventilator for 11 of them. Her short-term memory was impaired for months. She underwent occupational therapy, speech therapy, and neurological monitoring every 3 months for a year. As of the last published case update, her cognition had substantially returned. She is one of fewer than 10 people in recorded American medical history to survive. primary amoebic meningoencephalitis from a domestic water source. She stopped using the hot tap to boil water. She told her daughter to stop using it too. Her daughter told her friends. None of them had been told this by a doctor. None of them had seen it on a health website. None of them had ever had a reason to think their kitchen tap was something to worry about. Carol survived because one doctor on an overnight rotation asked one question that was not on any intake form at any hospital in Arizona. 6 hours earlier, and the drug arrives before the damage compounds. 6 hours later, and this is a different story. The margin was one question, asked by one person who remembered one sentence from one case study. That is the system failure, not the tap, not the pipes, not the amoeba. The failure is that the information sits in medical journals and Centers for Disease Control and Prevention surveillance reports and continuing education modules that most people never read, while the danger sits in infrastructure that runs through the walls of every home in the country. Here is what you need to know. Naegleria fowleri is not only in lakes. It has been confirmed in municipal water supplies in Louisiana, Texas, Florida, and Arizona. It thrives in pipes during prolonged heat. It concentrates in water heaters. It can be aerosolized in steam. You cannot see it. You cannot taste it. You cannot smell it. Here is what you can do. If you use a neti pot, use only distilled, boiled, or sterile water. Never tap. This is guidance from the Centers for Disease Control and Prevention that most people who own a neti pot have never heard. If you live in a state with prolonged summer heat, flush your hot water heater annually and set the temperature to at least 122 degrees Fahrenheit. At that temperature, the amoeba cannot survive. And if you or someone you love develops a severe headache with fever and neck stiffness, especially in summer, especially in a warm water state, especially if there has been any nasal contact with water, say these exact words to the emergency room doctor. I need you to rule out Naegleria fowleri. I need a wet mount of the cerebrospinal fluid, not just a standard panel. They will not think of it. The condition is too rare and the question is not on the form. You have to think of it. And now you can. Carol Watkins boiled pasta water on a Tuesday evening in November. She did nothing wrong. She did nothing unusual. She did exactly what she had done 100 times before. That was the entire problem. This is system failure. I'll see you in the next waiting room.